Hello, everyone. Thank you for joining today's session. Today's guest speaker is Dr. Karun. To describe Dr. Karun, Dr. Karun has done his MD medicine and has 8 years of experience with government and private medical college. Doctor has also played a very vital role in Andaman and Nicobar Island during the COVID scenario. And along with that, doctor has an interest in teaching students, and he is also a journal reviewer for the various medical journals. A very warm welcome to you, doctor.
Yeah, thank you so much.
Yes. Doctor, to start with, as we know that today we are addressing the student, those who have just completed their NEET exam and they are confused about which specialty to choose. So could you please give insight about what is general medicine and what is general medicine all about?
Yeah, very good afternoon to everybody over here. As there was a brief introduction about me, I am in this general medicine field for more than 8 years. And with some confidence, I can tell that because of the modernization that is happening all throughout the world, especially after the COVID and all these online things which are coming down, general medicine is such a subject where one thing I can assure you that even if you are placed in a remote part of the world, you can connect with your patients in many ways through the technology today. That is the first point that I want to tell, because as we all know, the history of medicine it dates back long before what we actually know about the present general medicine that we are actually going through. Okay. So, though in terms of foreign as well as in terms of Indian medicine, both, general medicine plays an important role in actual diagnosing the cases, so that they will be categorized into either these patients need any immediate intervention in the form of surgery, or immediate intervention in the form of ICU setup, or there are something like chronic illnesses also, which could have been managed even on this home based also. It is not required for the patients to come into the clinic or to the hospital. Um, this is the advantage of this branch as such. Plus, if you see the opportunities after general medicine, it's more than 9 super specialties right now, which is available in our country as well as in the foreign countries also. So this is the major advantage of this. Coming to the patient doctor relationship in case of general medicine, this will be a longer duration. I mean, if a patient, for example, if he is diagnosed with any kind of a chronic illness like hypertension or diabetes, and if you are the first person to diagnose it, I think there will be a lot of thing associated with it. For example, a moral support, psychological support, in terms of medicine. All these things are usually done with the help of general medicine consultant physicians. What I want you to know is, general medicine is such a subject, especially after COVID. Everybody came to know that yes, there needs to be a doctor who is kind of an all-rounder. I can say with confidence that it should be something like an all-rounder thing has to be done. Okay. So coming to the what after general medicine, brief about this.
Doctor, before that, can you please let the audience know, like doctors know, that is general medicine divided into any sub branches? Like there are different branches in all other specialities. So is general medicine also divided in other specialities?
For presently, when they do the post graduation, they will be given a rotatory kind of residentship in all the different subjects of medicine. For example, nephrology as such, cardiology as such, neurology, rheumatology. And these subspecialties, what we are going to be exposed, they are not actually classified or they are not actually divided. It's something like a unified part of all these things. So at present, even including the critical care medicine also, there is no such divisions inside the general medicine unless a particular resident develops some kind of affinity or some kind of liking towards particular subspecialty. As such, there are no different distinct general medicine. And there is also a small debate going on actually when I see the social media also, that whether general medicine and internal medicine, family medicine, all these things are same or not. I can tell you that family medicine is an entirely different department as such, but internal medicine and general medicine, these terms are used interchangeably, but both will be the same. Internal medicine as well as general medicine will be the same.
Okay, so doctor, to speak for the career opportunities, like how is the career opportunities for the doctor, and if they choose general medicine, like do they have a very hectic life? Do they have work-life balance or not?
Yeah, we will divide this into residentship and post-residentship. Okay, so coming to the residentship as such, see, nowadays when this Indian medical graduate, actually from now on, the doctors who are coming out from the medical schools of India will be called as Indian medical graduates. This is the new term which has been given. And what is expected of Indian medical graduate is more when compared to the previous MBBS graduates that we used to call. And once they belong to something like internal medicine or general medicine residentship, definitely depending upon the medical school they are going and depending upon the patient load, a little bit of hectic work will be there for 3 years of residency. That includes both in the form of academic as well as in the form of clinical forms. In the form of academic, if I have to tell, as we all know that we have to do the thesis for extensively for at least 2 years of study, and this thesis also should be something related to the particular department itself. So there will be something like thesis, that is most important thing that has to be done. And nowadays, NMC has given out specified learning objectives, specific learning objectives that needs to be fulfilled by a person who is actually doing the residentship. This has been already implemented in the MBBS level, so that at the end of this, a student should be knowing all these things. When we go back a decade earlier, it was not so hectic in the term of academic as such, at least. Presently, academics comes first, then comes actually they're developing the clinical skills. Only if they know something, they will be able to perform the skills, they will be able to use the skills to enhance their clinical entities. So 3 years of residentship, academic wise, definitely yes, thesis and all the other academic journals. If I start 3 to 4 days of climbing the residentship. Apart from this, since it is an emergency subject, see, we classify most of the subjects that we go in for the PGs as emergency and non-emergencies. Okay, for example, if I have to tell if it is a dermatology, there are probably no emergencies that will be happening overnight, and even if it is an emergency or something, it will be handled by the parent department. For the dermatology, the parent department is again the general medicine. So when we come to the clinical part of this post-graduation, definitely yes, there will be hectic duties. There will be night duties. There will be 36 hours continuous duties. And as we all know, the Indian labor law tells that a particular person we should not be doing more than 45 to 48 hours of work per week. But that doesn't apply for the residentship. And we also know that time gap is so small in 3 years that we need to be exposed to most of the cases which will be coming in and around, as well as we should be able to pick up it very early. So if you want to have that kind of skill, that picking up the cases as early as possible, definitely yes, you need to have this kind of hectic duties for at least 1.5 to 2 years of your residentship. Post that, once you become third year resident, definitely in most of the medical colleges that I have worked and I have done my post graduation, you will be able to take advantage of those 2 years of work which you have done hectically at night. Sometimes you might have you might be visiting the wards, even though if your duty is also not there, just to make sure that whatever the treatment that you have started, whatever the diagnosis that you have made is right, and the patient is actually recovering. And you will also come to know the what are the signs in which the patient is actually recovering, so that it will be easy for you, even remotely after 5 years from there, 10 years from there, it will be very easy for you to remotely also assess the patient and know the improvements that is happening with the patients. These things can be assessed only if you do an hectic duty in the first 3 years of your resident life. Coming to the post-resident life, again, it has got many branches. If you want to pursue your super specialty in any branches, for example, again, if you go to the super specialty branch like cardiology, yes, again, you need to be hectic. Like it's a kind of hectic duty since heart doesn't wait for anybody. And all the graduates who is attending this, they will also be knowing that time is the muscle in case of myocardial infarction. So in that cases also, in the cardiology cases also, you need to be little bit hectic for another 3 years, the residentship. If you choose something like an endocrinology, rheumatology, there is a chance. I mean, when the students who are recently passed from the NEET, they will be knowing that there is a MCQ based on that also. What is the emergency that can happen in endocrinology? Yes, it is myxedema coma or something like that. So it is very rare, and it is not like a DM specialist has to be there to manage these cases. Even MD graduate or sometimes even MBBS graduate also can manage these cases. So again, if you want to pursue a super specialty, again, those will be divided into something like emergency subjects, wherein another 3 years of hectic life will be there. Or if it is a non-emergency subject, definitely you will be having a better work-life balance. And coming to the persons who will be stopping at the level of MD graduation, like they will be doing their general medicine, and then what they will do is, there are many options for them, especially after, again, I'm repeating this again and again, because after COVID, there is a lot of opportunities for general medicine physicians, because a patient needs one particular doctor. He cannot visit many doctors for, like, for example, nephrology, he has to visit a doctor, or cardiology, he has to visit a different doctor. And there will be overlapping of the drugs, that is called as polypharmacy also, that occurs. Patient will not be satisfied. Patient will not be able to get connected to each and every doctor in the same way that he gets connected to the primary physician, that is the consultant physician. So most of them, they will stop at the level of general medicine, but they will be upgrading their skills in the form of doing a short-term fellowships here and there. For example, an endoscopy fellowship, echocardiography fellowship, neurology fellowship, stroke fellowship, epilepsy fellowships. There are many options for fellowships also, so that they will be upgrading their skills, but having the same degree for MD, and they will be actually in contact with the patients for a longer duration of time. And they will be knowing what has to be done for this patient, which is the best way, what is the best management that can be given for this patient. In the likewise, it will be having an option of going to private setup, that is corporate hospital, or they can join a medical college, whether it is a private or a government medical college. So advantages of both are there are advantages for both, and as well as the disadvantages for both. Coming to the corporate hospital, if they join as a consultant, like initially they will be taken up as registrars, then junior consultant, then they will become consultant, then they will become senior consultant. It is the growth. It is just the growth in the corporate hospital. More often, this corporate hospitals, you will have some kind of facilities that will help you diagnose the patients when compared to the medical colleges. See, to be frank, medical colleges, if you have working in a medical colleges, there are some always there are some limitations. Like there will be a delay in every particular investigations, all those things. So I cannot assure you that there is no better treatment available in the medical colleges. But when compared to the corporate hospital, yes, medical colleges do have some limitations. But when you compare the hectic life in case of corporate as well as in case of medical college, obviously it is hectic in case of corporate hospitals. Okay, so that's because you will be the whole and soul for the patient. You will be knowing that what has to be done, how it has to be delivered, and what amount of time you have to invest in counseling the patients. All these things comes more so in case of corporate, but in case of medical college, most of the time it will be a shared responsibility. The unit's responsibility is the one, and even if you have taking a leave or something, that you will not be held responsible because you are not on that particular day's clinical rounds or something. So yes, general medicine, it is all dependent on us. 3 years of residentship, nobody can escape. After 3 years, it depends on us what kind of life do we have to choose. So that I can tell you that summarizing all these things, all these points, there is still everything in our hand if you take a general medicine, because it is not an surgical branch. First of all, you need not to be there at all the time with the patients. You can remotely also assess as well. There is option till you finish your DM also. I mean, you can still choose to not to have involved in the hectic life job or emergency life job. You can still have your work-life balance better if you take this kind of subjects.
Okay. Doctor, to give an idea to the doctors, like when it comes to the different specialities, uh, every specialities have different ways of handling the patients. So, do the doctors need a very good communication skills, and do they also need too much of patience to understand or to diagnose the doctor, like diagnose the patients? Could you please give an insight about this?
Yes, actually, let me start this by telling the famous word, the patience is virtue. Especially medical graduates in India, they have to be more patient. They have to develop more patience throughout their life. Even one day before retirement also, there can be any mishap and all those things, the chaos, everything occurs. Because as such, the Department of Medicine is considered as the one which will be like an end stage for all the specialties. Let it be an OBG, let it be an this thing, surgery, orthopedics. If something goes wrong very badly with the patient, definitely that will be towards our department only at the end, because either there will be a shock or something like that. So finally, it is all the responsibility of the physician who is there on that particular, either it is a hospital, college, or clinic, or nursing home, or whatever may be this. Especially general medicine doctors, they need to be more patient. They have to develop skills to overcome the smartness of the over smartness of the patient as well as attenders. See, we are living in a world of Google. If you tell anything, the next moment they will be getting the answer that they can counter you with all the rubbish arguments sometimes, or also they can counter with the legal, ethical arguments also. So the space, there is a very thin line between what you call this aggression, patience, and handling all these things with aggression and patience. Okay, so I cannot tell that you should be always patient towards the attenders. Like even if they're talking rubbish, also you should be there. Like only thing that will save us is the rule of the land. You should know the rule of the land. You should know some of the sections like criminal sections, all those things, so that you can counter it at the time. That I am not that dumb to accept what the patient attenders are telling. I can counter argue, and I can definitely make my point if all these things happen at the interest of the patient. Okay, so counseling, yes, counseling definitely plays an important role nowadays. At least we should understand that everybody has understood something like death is inevitable. Nobody can save you from the death. The only thing is, what is the respect that we give for the patient at the deathbed? That is more important nowadays. If the death is unattended, if there is something like there was no doctor available for that particular patient, even though we know that we couldn't have saved the patient, yes, that becomes a problem. So counsel the patients as early as possible when they get admitted, so that every day when you talk to them, you'll develop a rapport. If at all, if the patient is more than 5 days, 7 days of hospitalization, you will have an upper hand. You will know the patient's vitals. You will know the patient's mentality, moral support, psychological support. You will have it better. So definitely counseling, having patience, but at the same time, you should be smart enough to know the rule of the land. You should be smart enough to know some of the sections which gives you the total protection against any kind of violence on the doctors, even if it is not in our hands, even if it is a physical, mental harassment, whatever it is. You might have seen Hyderabad recently, a doctor was attacked with an acid, and that was not a pediatrician, and that was not at all his fault. And we are living in such a kind of world that you should know the rule of the land. You should know the patience. You should know the aggression, when to show the aggression. You should also maintain this along with your family. So you have to protect your family first for all those things. Okay, so you need to be very smart. In a sense, I can give an example. If at all, if the patient is not so happy with your what do you call this, care or something like that, definitely we should not force the patient to continue treatment in our this thing. That gives the, and this is under the law, and there is recently a high court decision was also given. If the patient is being referred in the interest of the patient, even though the specialty and the facilities were available in the hospital, due to any patient attendance aggression, it will be not considered a misconduct on the part of doctor. So you should identify these kind of traits. There are good people, there are bad people. We cannot tell that this person is good, this person is bad. There is no particular device that will detect that he is good, he is bad. But what I can assure you is, if you talk to the patient attenders every day without fail, if you know that this is what is happening with the patient, if you are confident about your clinical judgment, if you are confident about your diagnosis, yes, definitely you can counsel the patient. You can make sure that you will have all these things under the same roof without any much chaos. So yes, counseling definitely plays an important role, and that has to be done every day after every rounds, especially in the Department of General Medicine.
Okay, so once the doctor complete their 3 months or like 3 years of study in India, and if they want to go and work outside India, like they want to do their super specialty outside India, so is there any growth in general medicine if any doctor wants to shift to another country?
So yes, in the residency of general medicine, there are two things. Like everybody knows that there is MD, there is DNB. Okay, so DNB is recognized in most of the countries. Most of the Gulf countries, they will recognize DNB better than MD. I'm not telling that MD is not recognized over there, but yes, they want DNB residents to be there in their hospital because they will be working in non-medical colleges hospital. So not attached to the medical colleges, those kind of hospitals. So they will be knowing better corporate things, like the way they has to communicate, the way they have to admit the patients. So because of these reasons, DNB residents of general medicine are usually given preferences in case of Gulf countries. Okay, point number one. Point number two, USA, UK, Australia, Canada, Singapore. They won't recognize the MD degree of India unless it is done by AIMS and PGI. As far as I know, I don't know the recent things, because when I did my residency, it was so evident, it was so popular among us. Like if you have done in AIMS or something like that, at least I'm not telling they will be given the job similar to the general medicine, but at least it is kind of recognized in some of the countries. Not definitely in USA, UK, this thing, Canada, Australia, they will not recognize even if it is from the AIMS, but at least in countries like Singapore, Malaysia, all those things, they will recognize the MD degree from AIMS or PGI Chandigarh. Point number three, there are medical colleges which are established in Maldives, Philippines, some part of the China, wherein you can go with the MD degree from the India. You can work there as a medical school teacher. The designation given over there is medical school teacher. You will be able to teach with the help of your MD degree, which is available, which you have done from India. Next, work as such. If you want to work as a consultant, it is very difficult unless you pass the medical licensing exam of USA PLAB. You have to write the PLAB and you have to do your MRCP here. And if you have acquired an MRCP, you have to do some observership in case of UK. Then yes, they will consider you as postgraduate. I mean, the specialist, general medicine specialist or something. As such, MD degree and DNB degree, except for in the Gulf countries and some parts of some island countries, it is not recognized outside the India. And your MBBS is recognized all throughout the world, but you have to pass each and every country's individual medical licensing exam to get into the residentship again for 3 years over there. Again, you have to complete the 3-year residentship if you're taking an internal medicine or infectious disease. Then only you will be given the consultant job over there in the other countries. So Gulf countries, yes. Islands, yes. But US, UK, Canada, Australia, no. MD and DNB both are not recognized.
So, doctor, the last question, if any of the doctor choose general medicine as their specialty, how much salary they can expect? And is there chances for the doctors to start their own private clinic in this particular specialty?
Coming to the salary wise, post MD general medicine, as soon as they finish their general medicine, yes, medical colleges, yeah, like everybody knows that the Indian government has a plan to start medical colleges in all the districts. I mean, if you consider it, if you correlate with the MP constitutions right now, 543 medical colleges should be there at the end of 2028. That is their vision at present. Even if you add some 5 to 10 years from then, at least by 2035 or 2040, definitely there will be medical colleges in all the districts of India. And each medical college needs at least 8 to 10 general medicine consultants in the form of various assistant professor, senior assistant, associate professor, professor, HOD. All these things has to be there. So what I can assure you is, I don't think so. After the finishing of your MD medicine, your starting salary in the medical colleges itself will be more than 90,000 to 1 lakh per month, and it is a 9 to 4 job most of the time. The same person, if he joins as a registrar in the corporate hospital, I'm talking in terms of South India. I'm not sure about the North India. Even I think North India is still more better packages over there. But after this thing, if you join a corporate hospital, nowhere less than 1.2 to 1.5 lakhs per month. And if you do the super specialty also in some of the residentship, in some of the DNP colleges, something, you will get a handsome salary of 75 to 80,000 rupees per month. If you're doing in Mumbai, like metropolitan cities or something like that, you will be getting a handsome salary there also, along with that, whatever the residentship, I mean, DM or something that you are doing. So as such, if you want to join a medical college, if you want to join a corporate hospital, I mean, I don't know how if you correlate with the inflation rate today, I think you can lead a decent, very much decent life with a salary of 1 lakh of something more than, more than 1 lakh, definitely you'll get it. Apart from that, if you want to open your own clinic, see, I would like to suggest that if you want to open the clinic, do it as soon as possible. Do not wait for 3 or 4 years. Do not wait for 5 years, or do not wait for having a corpus amount. Then I will start a clinic. Why? Because the skill of general medicine is not in the hands. It is all in the heart. It's all in the mind. If you want to connect to the more number of patients, you need to have more time. You need to spend more time in the clinics. So, okay. So if it is a surgery or something, surgical branches, definitely the skills, the hands, that matters the most. Here, it is all how you, the way you communicate, the way you talk, the way you spend the time, the way there is a famous saying that if I have a table on BP apparatus, I can earn some bread. So the general medicine guys, they will tell every time. It's not so simple also. Getting the license for the clinic, maintaining the clinic, timings, and you need to be available all the time, and there should be an helping hand all the time. There should be a pharmacy which dispenses better medicines. Nowadays medicine is available very much easily all throughout, so that we are not sure also. Even if sometimes we give the best medicine possible, but most of the time, because of the brand or something, will not be able to get the best brands also. So if you want to open a clinic, plan in such a way that the pharmacy, your clinic should be done as soon as possible. As soon as you have an idea that I will be staying in my hometown, I will be with something like I cannot leave the hometown and go for the metropolitan city. Do it as soon as possible. Clinic actually is the best thing that a general medicine guy can do, because it is all his own. The patient who comes to the clinic comes only with an intention to show to the particular physician. If they're going to the hospital or medical colleges, they will not be sure that who will be seeing the patient. But if it is for the clinic, definitely for that particular person, that means there is a brand value building around that particular clinic. So clinic, yes, very good opportunity. And if you want to do it, please do it as soon as possible, so that it will be economically feasible. You will be young enough to know like when to start, like even if it is some kind of losses incurred, you will be able to manage it.
Okay. Thank you so much, Doctor, for answering all the questions. Doctors, the forum is open for the Q&A section. So if you want to speak to the doctor, you can please raise your hand. I'll unmute you. or you can also post a question Q&A that doctor can answer. So, doctor, to end with, would you like to give any message, a last message to the doctors?
Yeah, one short message from my side is, see, even I was not sure when I took general medicine. Actually, I was very much interested in general surgery, actually. But actually, I am actually blessed that I took general medicine for many reasons as such. See, I'm also growing through this phase. I came to know that, if you diagnose a particular person's disease without cutting open the body, that itself is satisfaction for you. As well, if you treat the patient even without cutting open the body, that's the best thing that you can experience as a general medicine consultant. I wish the participants over here, the persons who will be watching this video, to know. If they want to come to the general medicine, definitely I would be more than enough happy to welcome into the community of general medicine.
Okay, thank you so much, doctor, for such a wonderful message. Doctors, do you have any question? Please do raise your hand, or you can also type it in Q&A section. Doctor, for now, I feel like there is no question asked in Q&A section.
Yeah.
So probably I can collect the Q&As and I'll mail it to you if there is any. Thank
Sure.
you so much, doctor, for your time, and thank you so much for such a wonderful session today.
Yeah.
Yes. Thank you so
Yeah,
much,
great.
participants, to join the session today. I'll end the session here. Thank you so much, doctor, once again.
Yeah, thank you.